Hi, Dr. Sheetel.
Hello.
Okay, please let me know about yourself, your background, and what are you doing nowadays, and what is your business, and what services are you providing?
Yes. Let me start by telling you something about my background.
Sure.
When I started my practice as a doctor, as a trained doctor in homeopathic medicine, alternative medicine basically. And when I started seeing my patients in my practice, so what used to happen was the the patients used to come with some kind of a body, some kind of a problem which is affecting their physical health, So they would come with certain diagnoses after going to a lot of allopathic doctors and all this, and then they wanted, because their problem was not getting solved, they wanted something which would take that problem out from their roots. But when I started treating them, I used to give them homeopathic medicines, and I used to try to tell them certain things which would help them to cure their disease from the roots, which is apart from the medicines. But it was just happening that I felt that I needed that kind of I needed to give those patients a lot more, had to come from my side, which was not just medicines, but it was like I wanted to actually heal them. But because I was just a doctor, and because they were just coming to me only with expectation of medicines, so they just were coming to me with expectation of instant fixes. And I was the one who wanted to show them that we can do a lot for you, which is beyond those instant fixes. I can really take your disease out from the root. But for this, I have to heal them, So I felt that need to learn these healing modalities. Like I wanted to go beyond just medicines. I didn't want to just take out a prescription pad and write down the names of the medicines and just send them. I was not feeling happy. I was not feeling satisfied doing that. So I decided to study these healing concepts and a lot of mind-body healing techniques. So I spent all my time, whatever free time I had, I spent in learning more about the biofield, about the energy medicine techniques, and things like mind. Actually, the disease originates so much from the thoughts and from the mind, the origin and the evolution of disease. That is what I concentrated on. And then with all the knowledge, with so many things that I have learned over these years, I really felt that now I am ready to give that complete, not only cure, but also healing to the patient. So it is not that it is just an eradication of the disease from the root cause. It doesn't just stop over there, but it goes beyond just the cure. It is about like you have to also maintain your health at a certain level, so as not to fall sick again. And you have to, as the definition of WHO, like World Health Organization, like how they define health. What is health defined as? Health is defined as complete ease in the mind, body, and soul. And that when a person is healthy, he's able to have the maximum energy and productivity, so that he's able to not only carry out his normal everyday duties, but he can also think about his purpose of life, and he can also keep not only himself happy, but his environment, his family, and everything, everything around him is at that harmonious state. So that is the actual definition of health. But honestly speaking, in the medical science, this is completely being overlooked. If you go to any doctor, then the first thing that a doctor is going to do is just take out the prescription pad, give you 5 to 10 minutes, and just simply write down the medicines or maybe some laboratory tests and just send you. So this entire approach, where you look at all the aspects of connection, of how the disease is connected, like to the not only the physical body but also the mind and also the soul and also the energy field. And there are so many intricacies and there are so many things that are going on at the cellular level. So this is not only about energy, but it is also about things that are happening on the cellular, on the microscopic level. So everything is like to be connected. And the patient, actually I don't want to call them as patients, because now I have started looking at people as people. I don't think of them as patients, because
Like
if I look at somebody as a patient,
as a human, right? They are human beings, right?
pardon?
Human beings, simple normal people.
Human beings, right,
Yeah,
right. Because when I was just a doctor, I was looking at people as patients. I was looking at everybody as a diagnosis.
Right.
So it was like whatever the person was suffering from. Okay, if let's say somebody has IBS, or somebody has depression, or whatever the diagnosis is. So I was looking at them as patients. But now I'm not looking at the diagnosis. I'm looking at the person who's behind the diagnosis. So it does not matter what is the name of the diagnosis. It could happen, when the diagnosis is established only when it comes into your physical body. So only then you would be able to detect it in the lab test or in the signs and symptoms, and then you would call it as a diagnosis. But there are many things which are going on beyond even before the person gets diagnosed. So in that case, you would not have signs and symptoms which are visible like in the laboratory test, or which are visible on as such on the physical body. But when you are interacting with that person, what's happening to that person in the entirety. Like because there are now 5 layers of our body actually. Now one is our physical layer, one is a subtle layer, that is the energy layer, one is the mental layer, one is the intellectual layer, and one is the soul layer. So there are 5 layers of our body, out of which we cannot see the remaining 4 layers. We can just see the physical body. But actually the main thing what I want to tell you and everyone else who's listening, body is just the manifestation. Body is never the creation. So when you have any problem that you're experiencing in your body, it is actually a manifestation. It is actually a reaction, or it is actually the end result. So this is something that people have to be educated about, because the disease starts in the upmost layers, and then it comes to the physical.
Then it comes to the front physical life.
Then it comes to the physical layer. So when something happens to you, like you have a pain or a discomfort or let's say any kind of a diagnosis does not matter. But whatever it is that you're noticing in your physical body, it is actually a reaction or a manifestation. But where the medical science is failing in this respect, that it is starting from the level of the physical body.
Right.
It is not taking into account all the other things that are happening just because they think it cannot be seen. But let me just ask you something, that if I'm like if there is somebody who's sitting, like if somebody is sitting in front of you, of course you cannot look into that person's cells at that point of time, right?
Definitely.
So, but then it does not mean that nothing is happening at the cellular level. Just because you cannot see something doesn't mean that there's nothing happening over there.
Right.
There is definitely things that are happening which we cannot see. But so those things have to be taken into account, and the origin and the evolution of disease, that has to be found out. And accordingly, the treatment has to be formulated. So when medical science calls it as treatment, or at best they would say that it is curing, but what we call it as, we say it's healing.
Healing, right?
Because it is not just that I'm curing a person from the thyroid problems. There is a person, he has a thyroid issue. I will not only be just eradicating his thyroid problem from the roots, but all the things that are happening with the person's life, and what are the events the person has gone through in his or her life, and whatever things that ought to be corrected in the energy field, the blockages, those blockages have to be removed. Because today I am treating him of thyroid, but tomorrow, if those blockages are not addressed, he could land up with some other problem again.
It means that it has to be eradicated from the layers which are not visible.
Yes.
And
yes,
otherwise the situation can be repeated again, or maybe worse.
Yes, it will be repeated again and again. Now, another thing what I want to tell you, one very important thing out here is, now, usually this is what has been observed, this is what we are observing is happening, that whatever qualification a doctor or a healer has, that doctor or that healer would only view that problem according to his or her qualifications. So suppose like you would go to a skin specialist, so that person, that the dermatologist is going to view all the problems as related to the skin, and he's going to only think about only that much as to what he's trained in. So this is in the medical science. But if you go beyond medical science, like if you go in the field of healing also, the same thing happens. Like if there is a person who is trained in homeopathy, so that person is only going to think about homeopathy and homeopathic medicines and the homeopathic approaches. And if you go to, and let's say if you go to some other practitioner of some other modality,
right?
Take any healing modality, for example, take Reiki or anything. So that person is going to view everything only with respect to whatever that person is trained as. So now what I want to explain out here is that these both are actually two aspects of the same thing. These are not independent of each other. Honestly, what we want is an integrated approach. What we want is actually when you are looking at the person, so with respect to whatever the problem that person has, you have to decide you have to take a combined integrated approach, and you have to understand the person you have to apply those concepts, and you have to understand and combine these modalities so as to achieve that complete level of healing, So it's not these, as people think that these things are independent of each other. And what happens is that when a person has a problem, they have a very difficult time in deciding whom they should go to. Then they would just do a trial and error. So if I have a problem, then somebody tells me that homeopathy is good for my problem, so I go to a homeopath.
Right.
Now that homeopath is only going to give me homeopathic medicines. Then if it's like I'm not satisfied, or if my problem is really not getting really giving me that much relief. Then somebody tells me to go to a Reiki specialist, I go to a Reiki specialist. So every time what I'm doing is I'm changing the person who is helping me. So now the Reiki, because see, now these things are also little, if you see, then this medical science and this whole thing is very much commercialized also. So even if a person cannot treat by their system or method, but still they will not direct you to the right person. They will still try to use their modalities just because everything is so commercialized. So even if they know that, let's say that energy medicine, for example, cannot solve my problems and I need to take more help, but they will not tell me to do that, because they are only trained in the energy medicine. So they just want to capture the market and the patient. So they just want to only give their treatment, So they will, because it is not integrated, right? In our, like in this whole system, whatever is happening, the integrated approach is like very rare. What is required is that you have, the person should not have to have faced this kind of a confusion as to where should I go for my problem.
Like going from means that the person should not be confused, like going to for experiment purpose to one person, then another, then third, then fourth, and keep wasting money after money after money, and then feeling frustrated, like the problem is not resolved. What should I do now? And also the trust factor is destroying, like the person cannot trust on other experts just because of, okay, I have experienced the psychologist, I experienced the counselor, I experienced the Reiki healer, I experienced the homeopathy doctor. My problem is not solved. It means that this field is corrupt. The person can say that.
Exactly.
Because he's just randomly trying based on the opinion of those people who don't have the true knowledge of the field.
Yes.
They're just saying, okay, you have this problem, try Desi Totka. You have this problem, try to go to that doctor. And this is happening.
Yeah. So it just becomes a trial and error and endless wandering and then frustration, because it's like sometimes you are better, but you are never able to reach that point of your health where you deserve to be. Because when you are at that point of health, like you don't really, you don't really need to depend upon somebody else for your health. It just doesn't need to be that way, that, okay, I'm trying to take care of my health, but I don't know what's going to happen tomorrow. You have to be in more charge of your health. You need to feel confident about yourself. And this is not just your health. It is actually related to your life in general. Because your health forms a very major aspect of how your life is going to be. Because if you want to achieve any kind of goal in your life, if your health is not in place, you will never be able to actually, it would come in the way, right? It's a very big thing, because you would not have that energy, and you would always be in discomfort, and then you would always want to go, because instant fixes are not the solution. And what happens is, sadly speaking, our system is being made in such a way that doctors are not educated. Like in medical science, these things are not being taught. When you go to medical college, the only things that we are being taught is just the working of the human body and medications.
Okay.
So when you go to a doctor, even though they have all so much of knowledge, but still medical science fails when it comes to so many problems, right? And you must be knowing, everybody has got that experience. Even in the medical text, if you read, it's been written that this exact cause of this disease is not known, or there is no cure for this disease. They actually write. I can show you those examples.
And it is labeled incurable disease.
Yes, incurable disease. So, and sometimes there are so many things that are happening with the person that medical science cannot even explain. That's the funniest part.
Definitely.
So when you go to a doctor, there is a limitation, and the doctor can only do as much as he has the knowledge of the physical body. But then for that, if you have to go to some other person like a healer, then that healer should also be trained. He's trained in his healing modality, but he is not trained with the working of the human body. So these are the contradictions, because if you are trained in particular healing modality, but you don't know how the human body works, and you cannot connect into the things that work on the cellular level. If you cannot connect with things that are happening on the physical level or on the mental level or whatever the person is coming with. So if you cannot do that, then again, that healing modality also becomes incomplete in itself. But if the person does not have the entire knowledge to be able to apply or to use it. And so there has to be, our system needs to be integrated, where a doctor should be able to not only just take out the prescription pad and give medicines, but the doctor should be able to decide as to whether medicines are actually required in this case or not. Right. Only if required, you give medicines. I'm not saying medicines are not required at all, or I'm not disagreeing with the role of medications and the role of medical science. Of course, it's very important, and the knowledge is very important. The medicines are important, but medicines have certain limitations. The role of medicines is only to address your immediate concerns, and the role of medicines is only to bring you to a certain point where your body is able to tap into its own healing power. Once the body is able to once we activate that own healing power of the body, then the role of medicine stops over there. Then the medicines are not needed, because your own healing power can take over the healing. And we all have that healing power inside of us. It just requires a person to understand what's happening and to be able to activate it. You need help for that.
Right.
So this is how the approach actually should be. And this is what I want to do. This is what I want to tell people, that the problems that you're facing right now are just a manifestation. They are just like the energy blockages which are happening on several levels. It could be at the level of your thoughts, it could be at the level of your mind, it could be at the level of your energy. There are various reasons. It could be at the level of like what you eat, your lifestyle, your metabolism. There are so many things.
Right.
So all these things have to be taken into account when you are actually offering to completely set the person free from this ease. You have to bring that person to ease. So which is the actual definition of disease.
Right.
So even though this has been formulated like long back, like so many years back, who has given this definition? But medical science is far away from this definition. Now today, if you talk about this definition, it feels far-fetched, because nobody is able to spend, first of all, that much amount of time with you to understand you in the first place. So that is the first thing, because the first thing as doctors, when there is somebody in front of you, the first thing we need to do is we need to listen, and not only listen, we need to understand.
Right.
So you need to actually spend that much time with the person. You have to know their entire everything that leads to the existence, everything that is in existence of that person. So whatever information that you need in order to heal, you have to have that information. And
Like
then
it,
you,
okay, so it means that you should not be like someone, okay, this is your problem, here is the treatment, here is the medicine, go and take it. No, not like that. You have to diagnose properly, understand,
yes,
listen, and then see what exactly has to be done in order to completely heal and recover the person, so that he or she can
yes,
avoid this in future as well, not just now for the temporary purpose. Okay, try this experiment, try this medicine.
yes, yes, yes. And um, yes, that's the thing. So, uh, so basically, it's about like it's about creating that. Hello,
Yes, continue.
disconnected or something? Yes. Okay. So now there's one thing which I forgot to mention over here, which I really want to tell over here, that a lot of times it has been observed that your mind and your thoughts play a very major role in your disease. Like it's your beliefs, like your limiting beliefs and your attitudes towards life and attitudes towards disease. There are so many things that, when I used to take the cases, when I used to have those people coming to me, I used to uh, be really surprised, seeing the way I could easily connect, the dots, like, how the person is thinking to what he's suffering. But there has to be somebody to make that person aware, that look, this is why this is happening to you. This is why you're suffering. This is why this problem is happening. But just making the person aware is also not enough, because if you don't work with the mindset, if you don't change the mindset, then the person is going to go about life the same way as the person was going. And then there is no point of me curing that person from that particular problem, because if he's going to carry with that same mindset, tomorrow he could fall sick again with that same problem or some other problem.
Right.
So I have to actually, I wanted to
solve. So you want to solve this problem now, as
yes,
you are taking an initiative to come up as a service provider to solve this
exactly.
problem, and with a reasonable solution through your services,
Yes.
to help those kind of people, not patients, those people who are suffering, to help them recover and heal properly after you listen to them, then understand their situation, and then tell them, okay, according to your situation, according to your problem, this is what has to be done, and this is your custom package solution for your problem.
Exactly.
And that is how
So
much it cost for you, for your solution, for your problem. It's not like a prepared medicine that you need to buy right now, instantly recover. No, that is not like that.
No.
So you are coming up with a professional with your background of medical experience as a homeopathy, right? Homeopathy doctor, right?
Yes.
So you are coming up as a professional service provider right now, the step where you are, and you have been carrying your professional background of medical field, and from that experience you are coming now to offer your services, and your package will be according to the condition of the person who is suffering, and that will depend on the price will depend on the condition of the patient, like how much, right?
Yes, to some extent, yes. I mean, in general, it would be around about the same price, but in certain cases, of course, the price might vary,
Right.
because everybody's problem is different. So no two people are alike, and no two bodies are alike. So the plan which I make for one person, even if like there are two people coming with the same thyroid problem, the protocol for both of them could be different. Because each person is coming from a different background, different lifestyle,
definitely.
different mindset. So everything would be different, in both the cases. It could be entirely different also.
Entirely, right, definitely.
whatever is relevant, to that case, whatever is relevant to that person, only those modalities we would use. We would use, we would not just use something that it is not like a trial and error that we are doing over here.
Like,
we are actually working. Yeah, we are not just doing a trial and error that, okay, we have these so many modalities, so let's try this. We are not doing that kind of a thing. We have a problem and we have the entire case, and then we know, okay, in this problem you have to concentrate on nutrition. On this problem you have to concentrate, let's say, on CBT, or in this you have to concentrate maybe on some embodiment therapies, movement therapy. So for each person is going to be different. So whatever is going to cure that person in the shortest possible period of time, and whatever is most relevant, that will be used. And another thing is that we work with it's not that I'll be just giving the advice and it's over. I would be actually sitting with the person, with the patient, the person. And if they have any problem in whatever, suppose if they encounter any difficulties while using this program, or if they encounter any kind of, like if they're not able to understand something, or if they're not able to apply something, like maybe there could be many reasons why that could. So I even sit with them and I try to work out.
You will be around. You will be around to support. You will be around to support.
Yes, that support will also be given. So it's not that, I just give the solution and it's over. So that support will also be there. So that is something which I feel is very, very unique to be having, under one roof. And this is actually what is required in even like nowadays. Integrated medicine is like full booming, like it's like the rage, and a lot of doctors are turning towards integrated system of medicine. So, but the thing is, because it's so new, it's such a new concept, so people don't know about it yet. And
definitely it's very simple, because you look back the history. Whenever there is something that a person thinks to bring in the society, let's take the example of Einstein, Newton, and other kind of people who are genius in their times, including whatever field they were related to, any person. It is very simple that the most people, as we know, most people try to copy paste. They are like copy clones of each other's. Like they are going to the same education system. They are coming out with the same type of knowledge, and they are focused on making money. Almost most people are focused on making the money.
That is what is happening to medical science.
Exactly. So just because they are focused on just because they are focused on money. So as I also perceive that the very less percentage of professionals is very dedicated to solve the actual problem of the client. Like it should not happen again. Even if it's related to website troubleshooting or body troubleshooting or the technical troubleshooting or any other kind of troubleshooting, it is like a troubleshooting. A person is technically checking and assisting and reviewing and understanding what exactly is the issue, and then fix it in a way that it should not happen again, at least.
So what I call this, like, because this is so unique of its kind, so I have actually, like, I call it the comprehensive medicine and healing protocol.
Then you have to bring awareness.
Medicine,
then you have to bring awareness. You have to bring awareness about it as an educationalist.
CMHP. Yes, so I call it a CMHP. So I can say that I am the proud inventor of CMHP now. And in this I have used this word comprehensive. Just, comprehensive means you have everything that you need in the form of, it's not just medications, but medicine. So medications and medicine, these are two different words.
Right.
So that's why I've used this word medicine and healing, and then protocol. So which means that there is a complete plan in place, and then you have everything you need, to get, because that's the thing that, I was feeling so sad when I was just practicing simply only as a doctor. I was not having that job satisfaction, even though my patients used to come and tell lots of good things about me. Okay, they used to even give me reviews, and they used to give me compliments, and they used to actually post the reviews even when I was not asking for the reviews. I never asked for reviews from anyone, but they used to go and they used to post and all these things.
But you were not satisfied, like something is missing. Something is missing.
I was just feeling that something is missing, and even though those patients were very happy, but I just wanted to stay connected to them in that way, that every time they land up in any kind of a problem, I should be able to solve it. So I don't want them to be just happy because just that part of their problem is solved, or that part of their life is solved, because there is so much that is happening in your life. And sometimes there are things which happen, let's say, like now I can give you an example. Like I had one case of depression. Now I'll tell you, this is something which is very important. I really want to share this person actually contacted me, and he said, I have depression. He just contacted me with a diagnosis. And then I asked him, who diagnosed? Who has given you this diagnosis? So he said, no, I know I have depression. Like, I've read about it. And, so it was like kind of self-diagnosed. And, if I would have if I was wanting to make money, or if I just wanted to just approach it like from a doctor's point of view, I could have done that at that point of time. But I didn't want to do that. So I asked him, like, okay, so you just try to tell me what's happening, what happened in your life, and what's actually bothering you, and how did your depression start? When did you actually feel that way? So then he gave me he told me one incident that happened with him, that he had a friend, like a very close friend, and something went wrong with that friend, in her life. And because something went so much wrong, then he took that entire blame and that entire negativity on himself, because that person was not able to face situations. And this person took everything on himself, because this person started feeling responsible for that person's life. And all that negativity he started carrying inside him, that person's negativity, that association with that particular person, because he was so that due to that friendship or that attachment. And because of all that negativity, he was suffering for so many years, and then he left his job, and he had no desire to do anything in his life, and so many things like that. And all that I tried to do is, I did not want. See, he was like, he was thinking I will give him some medications, I will give him some medicines for his depression. That is what he thought when he came to me. But I told him that, look, I'm not going to give you any medicines over here. I am going to straight go into energy healing, and I'm going to show you ways to heal yourself and come out of this whatever you're facing, this energy that is surrounding you, that has to be corrected. So the moment you align yourself to a different energy, a different vibration, you are going to instantly feel, not instantly, but you're going to feel better on a permanent basis, not only instantly. So we tried some techniques on him, like I showed him some ways and some techniques to use, which he could use every day. And I sat with him. I worked with his mindset. I tried to understand him as to how he could use the techniques, in in a very in the way that he understands, which he according to his capacity. So all those things. And after that, the patient was completely out of his depression, because he was just holding on to that diagnosis and that self diagnosis what he had made, that I am depressed. So whatever action was happening in his life was related to what was going on in his mind, that I'm depressed. So everything is like revolving around that depression. So there is no person, that person inside him has died. There is only the depression that is surviving. So he has limited himself only to his diagnosis. So we have to go beyond. We have to see the person behind the diagnosis. So I told him that first of all, you just see yourself as a person who is suffering from depression. You are not a depressed person, but you are a person who is suffering from depression. So we have to change the statements, and then this was just a starting statement, but then we go beyond and we change the self-talk, and the statements. So all those things we worked around, and now that person is absolutely fine. So this is like an example which I want to give you, that sometimes things have to be tackled not in just like not in just a traditional way, but you have to understand what actually the problem, the origin, from where it's coming from, and what would actually work for the person.
Interesting. Very interesting point.
I know it sounds like a bit like sometimes it may not be it. I don't know if like it's if I'm being clear in what I want to convey.
No, you are very clear. It was very clear. I understood what you are trying to convey and saying. It is very clear. But it might not be clear for those who don't understand what really is happening and how you are going to solve the problem. They might not have, especially those who don't have the experience of this. Like if you never heard about ice cream flavor, so you will never know, no matter how many theory you can tell. It's very simple. Test it and experience it.
No, when I said it's not clear, what I meant was that maybe people are not clear about the fact that so many things are there, so it's going to take a long time, and how can we how can we work with so many things? And maybe some people might think that we don't have the money, or we don't have the time.
Yes.
Or I have to give so much time then to this thing, and I don't know anything about these things, so how it's going to happen? So these questions might come in a person's mind.
Definitely.
So in that way, I said it may not be clear. But let me tell you that the person does not have to worry about anything. They don't have to take any decisions. The unclarity comes when the person has to decide, that should I go for Reiki? Should I go to a nutritionist? Should I go for energy healing? Should I go for EFT? Should I try yoga? Should I try Qigong? There are so many things in this world. Like now, recently there was a patient who she's suffering from a thyroid problem, and then she took the decision she took some decisions of her own because she heard it from somewhere that this is good. But you have to know if it's good for you and your body and your problem, right? So there has to be a right person to advise you these things. It could be possible that you don't see, in general we say that exercising is good, meditation is good. But for each and every case, exercise may not be good and meditation may not be recommended. It could be possible that the person requires, some other form of exercise, which the person may not be aware of. So the person needs to be addressed according to their problem. So there are many things that could work better than the traditional ways, But what happens is the person decides for themselves, because so they have to go through all that trial and error and that pain, of that frustration and that wandering and all these things, okay, let me try this, try that. So here the good part is that the person can be just stress free because they just have to come to me and I will be doing everything. They just have to receive the healing. They just have to be in a
should be willing to
they should
receive.
be willing, yes.
Otherwise it will not work. If the person is not willing, I in my experiences, if the other person is not willing to receive, nothing works.
Yes. So all you need to do is you need to open up and you need to receive the healing. You need to be in that mindset that you have to keep your entire trust in the system and you have to just relax and receive the healing. So the first thing what I would tell anybody, just relax. I'm going to do everything for you. So you don't have to worry about like, you know, what should I do and what I should not do. I will be with you. It's not that you would come to me only today and that's the end of it. I would be like a support. I would be giving you that support. So I will be like, exactly, I'll be guiding you and I'll be telling you, okay, this is exactly what you have to do and this is what you don't have to do. So you don't have to worry about finding out and doing that trial and error thing. And even if many times people have like, what happens is what I have, this is another reason I came up with this CMHP protocol, you know, because I found that people are scared to take advice from a doctor because sometimes what they feel is that, you know, we have to do so many tests and then we have to undergo examination and then we have to take medicines. So sometimes they're scared of going to a doctor.
Test, and then a lot of tests and diagnosis and tests and reports and medicines and investment.
And then money is also one reason, you know, they are scared. And then because they are scared and they don't have that entire faith, you know, even if you see the allopathic doctors also, then somewhere down the line people don't have that 100% faith. They would still talk with their relatives or friends, or like they would go to the chemist or
first priority desi totka, first priority totkas and this kind of things.
Yes.
Before going to doctor, let's solve.
And maybe some educated person, like you have those what do you call them? You know, those quacks and those kind of people who use the magic wand and stuff like that. So they even like they when their problem doesn't get solved, you know, they just like become so panicky. Why they go to these unauthorized people is because of the fear and the panic. This is the main thing. So when you are in the desperate situation, you want to try anything that's available on this planet, you know.
Right.
If somebody wants to, so all these like fraud, there are a lot of fraudsters also all over the place who are doing this kind of thing in the name of healing. And even like when it comes to medical science also, then there are these kind of people. So we don't want these kind of situations to happen, you know. You want a person who would be giving you the right advice and who would hold your hand in the journey of your health, not only till your disease has been eradicated, but even after that, so that you can maintain your health and you can get to that level where you can live a purposeful life and achieve all your dreams, goals, ambitions. So that kind of a life everybody deserves, you know, and that life of peace, joy, happiness, you know.
Isn't it like
that is a birthright?
Isn't it like a doctor turned into the life transformational coach in the healing and emotional wellness and health? A doctor is come up as a life transformational coach. And when you come to Dr. Sheetel, she will take care together with you your hassles, your problems, and she will also utilize her medical background and her spirituality background, whatever is that, and utilize that to combine together so many dots to make you emotionally, mentally, physically, spiritually feel better again and move forward in your life with clarity,
Yes.
with clarity, happiness.
It's not about the terms actually. Like
there are so many terms. There are so many terms, but the purpose is simple.
But basically, in the end, what I want to see people as, like, I want to see that smile on the face.
Yes,
and
transform them. Simple.
It should not be like there should be an inner smile. It's not the smile on the face just. That person should feel that inner smile, from inside. That person should be feeling, should be like happy and peaceful. So this is what I feel it's a birthright of every person. Every person deserves to. Now, of course, only if you want it, you will have those things. I mean, or if you don't want it, then nobody can bring you to that point. So
definitely, you have to be willing to change. Otherwise,
that is another word of caution that I want to give. That okay, if you're coming to me and you have to be ready to get that kind of result. You have to be in that frame of mind to get it. So you have to be wanting it in the first place. If you're just looking for instant fixes, then I'm not the person for you.
Then so they should not disturb you.
Not for those.
They should not contact.
Yeah. So only, and then you have to be also ready to actually work with me the way I tell you to do the things. You have to be ready to do those things. So suppose if you go to a doctor and the doctor gives you a remedy and says that you have to eat an apple for 30 days. One apple a day for 30 days, and then come to me after a month. But if you go home and then you say that, oh, I don't know from where to get the apple. Oh, I found the apple, but I cannot take a bite into the apple. Or I do not have time to eat the apple. Or if you have any kind of like excuses, for not being able to eat the apple. So now you cannot blame the doctor, because the doctor cannot come and sit with you and make you eat that apple.
Right.
That is something that you have to do it. So even if I will give the best of advice to a person, you have to see to it that you follow their advice. If you're not able to follow their advice, I'm there to help you in whatever way I can. If you're not able to get the apple, I can show you places where you can get the apple. But I cannot come and put that apple into your mouth.
Definitely.
You have to open your mouth and put the apple inside. So that's how it works. So provided there are only two things which you require for my treatment. One is like you have to be in that state of mind to receive the best. You have to be wanting the best for yourself. If you are that kind of a person who wants the best for themselves, then you need to join this program. And you are a person who wants something beyond instant fixes. Then you can join my program. And you have to be simply receptive and just receive the advice or receive the healing or whatever I offer you. And just you have to be in a position to see to it that you follow it. And that's it. You don't need anything else.
So is it your program like where you want to work together one-on-one or group program? Like taking so many people together and trying to heal.
Yes, actually, we will be working one-on-one with those people who want a one-on-one consultation, like a one-on-one program, who have whatever concerns they have, so we can address them in a one-to-one program. Right. But then there are things which globally we all are suffering from. Like there are many things which commonly, if you see, there are a lot of people who are suffering from those issues, And if I talk about these things, like it is endless. Like for example, you have anxiety, you have depression, and you have weight loss, you have binge eating, you there are so many things that people are just suffering from, and like even though like so many people are suffering from, but still the cure for that thing has not been found. There are many diseases and medical conditions also like that where the cure is not found, and there are so many people who are suffering from that problem. So in those cases, we will be holding the group workshops, so that we can educate them and we can give them the knowledge.
Right.
So they will be able to use that knowledge in their day-to-day life, and they will be able to help themselves. Because everything is not medicine, and and it's not just one time that you could do. You need a constant help every time.
So those workshop or group that you will be bringing, will they be free or paid workshop?
Yes, we have both the options. We also have free workshops, and we also have paid workshops. So like if somebody wants to do an intensive workshop with a support group, and they want to enroll in that program, like we will be according to the program, it will be like the time duration will be set. So if they want to enroll in it as a residential type of a program, so that workshop could be like we could hold that. Maybe it would be paid off. That would be paid of cost, because we'll be intensively working with each participant as a group and individually also in that case. And then of course there will be a lot of free things, like because all this knowledge I have, I have a plan of launching my YouTube channel, and if they would just subscribe to my YouTube channel, they could watch the videos and they could get a lot of information absolutely free of cost. And of course there'll be free workshops as well. There could be like needy people and poor people who cannot afford maybe the workshops. Like they could be maybe under low economic status women, and women who cannot maybe women who are undergoing like a lot of oppression and problems in their life. So there could be like many such groups, sections of society. So for them also we could hold these workshops free of cost. Maybe that is one of my dreams actually in future, that I want to empower this feminine power. I want to empower the girls, and I want to empower the women, so that especially young girls who are at like the age of like from the 10 or maybe you can say 10 or 11 years onwards to 20 to 18 or 19 years, like this age group, maybe 10 to 20 years of age.
10 to 20, right.
So this is a very crucial age for a person, this teenage age, and for everyone it's a very crucial age, because there are a lot of like wrong decisions that you might take at that age, and a lot of things they have to understand as to what goes on, like so.
I have a question. Okay, I have a question. Like, why do you want to empower the woman related to the group age of 10 to 20?
That is actually related to my own story. So
okay,
I can relate with it.
So you don't want this to happen to other young girls?
Yes. Because see, I'll tell you, I really feel like I feel so sad sometimes when I think that I took so long to arrive at this point. I could have like got a person who would have guided me in the right direction years back, and this could have happened. But of course, like everything has got its own destiny, and our life purpose unfolds by itself. Like, so I have no regrets about that. But I don't want this to happen to other people. Because when a person is just like even like as a child, we need to educate them, because children also, they go through so much.
Definitely. So, in our society, they go through a lot of things in the family.
They go through so much, and every child should be given that empowerment. Every child should be educated, and certain things we have to tell the children, you know, as to if something happens to you, if something goes wrong, how can you heal yourself? How can you help yourself? Whom to go for help? How to communicate? How to feel safe, you know, with the world around you. So how to create that safe kind of a that help kind of a situation, you know. So if you don't educate the children, how are they going to? They're just going to get, you know, going to go anywhere, and they would not. How would they know, right? So our children have to get stronger, you know. So we don't have to wait till they grow as adults and something wrong happens with them and then we start educating them. That shouldn't happen. If at the outset we educate them, so they know like, if I'm feeling discomfort in my body, I got to like communicate, and I got to tell this to my elders. So right. The children have to be educated. They have to be educated about eating right. They have to be educated about like, if you feel sad, if a child is feeling sad, then, you know, we have EFT for children. You know, we have EFT techniques for children, which is very, very simple. So even a child can heal himself, you know, within just 2 minutes, 2 to 5 minutes. All it takes for a child to get out of that sadness.
Regarding
like resolve that situation
through the meditation or something else?
It's actually tapping, so that works faster. And yes, we also have to teach children meditation. Of course, everything is useful. They have to be taught whatever, like yoga, meditation, and nutrition.
How do you want to empower? Like, will you bring any will you bring a workshop for that purpose or a separate program? Yes. What is the idea?
Yes, I'm planning to hold workshops. Maybe something we can go to schools and
online or offline.
It could be done offline as well, but online will be much more better because the number of participants that could join from all different parts of the globe, you know. So that is
through the Zoom meeting, they can all join, right?
Yes, maybe through the Zoom meetings. Yes, it could be done that way.
And you can empower many of them at once.
Yes, empowering is basically, see, one thing, you have to give them knowledge, you have to make them aware. And you have to teach them some simple techniques, you know. Like, you feel anxiety. If a child is feeling anxious, you can show them, okay, what are the things you can do for anxiety when you feel anxious? So the child is able to use those techniques. They know what is anxiety. They know the feeling of anxiety. They know what is to be done. So
plus they can discuss. Plus they may ask some question and discuss, right?
Yes. They can even ask questions. We can talk about it. So there could be a lot that could be done.
Yeah, definitely.
So basically, all the economically deprived and the socially weak sections of society, and even our kids, because they are at a weaker position than us. They are helpless if something happens. So we need to do something for them.
Good point. Good idea. So it's like, if I can see here, you have a high ticket program, transformational program, like that will be used for those who want very exclusive access to you, so that you can spend and invest your time together with that person and try to bring that person out from the whatever situation she is suffering in the life. Not like an instant fix, but a complete transformation to heal and recover again back to the normal and happy life. And just because let's suppose if you are working with one person very exclusively and giving all the support, that you won't be able to like work with a lot of people on the same level with energy. So in that scenario, you have one to many, like you can use your YouTube channel or you can use your videos to provide one-to-many awareness, like they are
Yes.
learning through your videos who cannot afford to work with you one-on-one, and they can utilize
Yes.
simple your videos, and that will be like you are giving away your knowledge and telling them how to solve the problem, giving them solutions, giving them awareness, so they already have what they can not access and what they don't know before. But if they can afford, if they can invest, if they are willing according to your standard that you have, because who you want to work with and not, so they can bring their investment and they can hire you to help them, right?
Yes, yes. That's, yeah, sure.
And on the other level, you also have your other program like empowering and free workshop and sometimes paid
Yes.
workshop. And as a paid workshop, that is where someone who cannot afford to work with you exclusively one-on-one, he or she can use a paid workshop program as a group program where they can have some minor support, and you will be also available, but that will be not exclusive like the one who is your high ticket customer, right?
And yeah, actually, I'm even like I'm maybe not now, but in future, maybe we could come out with some with the educational transformation academy. You know, it would be kind of an educational program. So in that we would give all the knowledge that is required to be able to not only use that so you can say it will be kind of a first aid, you know, like how we have physical first aid. So there are so many types of like first aid that are required for so many situations. So the people should know, like it's not just like something that happens like, okay, you have pain and you use the first aid. So it's like so many situations. So we would like educate on those, you know, on that ground. So I'm planning to come out with an educational.
It's very simple. You can have a very simple educational YouTube channel where you are educating people through your channel, through your video content.
Yes.
And from your contents, they can see you as an expert, and they will have an how to contact you if they want to hire you. Otherwise, they can go through your free videos and learn, and you can utilize your YouTube channel to reach out to the global audience.
Okay. Yeah, right. There will be so many options.
Yeah. So, okay, if I ask, what are the benefits of your services as compared to other services providers?
Well, I cannot.
For those who want to work, who are looking for an expert like you, who is also a doctor, having a medical background, and now coming as a transformational expert and trying to help them to heal and recover, and obviously cure from their diseases. So what is your advantage? What are your like unique points as compared to, you know, there are many doctors who are also offering treatments, and there are many healers who are also offering their healing programs.
Yes.
And there are many magicians who are offering their magic programs, and even there are many like Reiki specialists and other kind of, obviously the end purpose for all of them is, as we can see, that they just want to heal people. Like people are going to them to solve the problem. Nothing else matter here. So how, what are the benefits to hire you and not to hire them?
Well, see, I would say I can only talk about myself.
Yes. You can tell your benefit, like what are your benefits?
Yes, because I have worked, I have started my journey only from just a doctor who was just catering to simply problems, you know, the physical problems. And even when I knew there was a lot of emotions and a lot of things going on with that person, but I was not able to tap into it because the person was not receptive to it and they were not aware of it. And then I also did not have those skills at that point of time. But now that I'm equipped with those skills to help people in every possible way, from the level of the level of mind, body, soul, which I have mentioned earlier. So see, I will tell you the things that what my program is going to give. One thing is holistic healing from the roots.
Okay.
That is of course there, which of course you get it. It's like other people also claim it, but this is like not just from the roots, but to maintain your health even when you are eradicated from the disease, so that you don't, the possibility of you falling sick is minimized.
Okay.
Why
This is the one
because
point.
you are in charge of your health.
Okay, so you are not just healing, you are giving them increased chance of not getting it again.
Yes, not getting it again. So the difference between me and the other doctors, the primary difference is that in the others, with the other healers or the doctors, the person is completely dependent upon the service provider. It's like you are the passive person and you are going and you are taking the healing or you are taking the medications. You are taking the advice. But here in this program, what is happening is I'm going to make you independent. I'm going to see to it that you're not dependent on me. I'm going to give you those tools so that you will be able to use those tools when you're sitting
again and again in future.
Yes,
as
again
well.
and again. You don't have to be dependent on me every time.
Okay. Clear.
Of course you might need me from time to time. You might, because your allergy, there are things which go wrong in our life. There are things which happen, events that happen. There are things which happen where again you might need my program. You might need to enroll in my program again. That can happen, and for that I am always available. But it's not that every time you're rushing to a doctor. You're not dependent on me.
Because you have given solutions that they can reuse for their own.
Yes. So this is one thing. So see, this is not to be underestimated, because when you feel a little more in charge of your own health, it's a very big thing. It's a very, very big thing. And usually no doctor would actually do that, because even no healer would do that actually. Because what they want is, they want the person to come to them again and again. What I want is just the opposite. I don't want that person to come to me again and again.
Like you are trying, it's like most service provider are going to hate you, dislike you. What the hell you are going to do? You are healing them. You are healing them. Like how if they are recovered, then where's the money?
Yes, but that is what I want to tell them, this thing that you should not be wanting to come to Dr. Sheetel again. You should be in such a good position in your life that you don't have to really come to me every time to reset you. You can do it yourself. So my job satisfaction is based on the fact how less the person is going to come to see me. So of course I am there for support. Okay, this is one thing that I'm offering in my program, is like the support which I'll be giving will be free of cost, and even like they will be enrolled in support groups as well. Whoever the person who is joining would have access to, there would be one membership to join, or to one inner circle kind of a thing, where there would be support groups. So the person can stay in that group for as long as they want, and at a very nominal fee, just at a very small fee, they would be getting this kind of a ongoing support. So that is one thing.
A fee would be like a monthly fee, right?
Yeah, maybe it would be monthly.
pay upfront monthly this fees, and you have an access to the group for the support.
Yes, you have an access. So that is one thing. Then another thing what they would get from my program is their emotional blockages. The person's emotional blockages are removed permanently. Okay? Because the person is being made aware of what is actually blocking their energy, what kind of emotions are wrong for them, you know, that is contributing to their problems and their disease. And, you know, so not only I'll be making them aware, but I'll be helping them to get rid of those blockages.
Okay. So means you are destroying their mental blocks, you are healing them from trauma, you are eliminating their fears, their insecurities, their self-doubts, and so many things.
Yes, all the self-limiting beliefs.
In just your one program, you are helping them with so many things. It means that you have so much values. You have so much value.
If you see each and everything that I'm speaking about, each and everything will cost at least maybe $40-$50. I've seen people charge like more than even $100 would be like less.
For per session you are talking, or
no,
what?
It's not per session. For each modality that I'm talking about, people are charging that way. People are just having programs on emotional empowerment. That's it, and they are only charging $300 for removing emotional blockages and emotional empowerment.
Okay, let's suppose someone is charging $300 for removing the mental block, right? Emotional block.
Yes.
So what is the, like, what are you trying to say here in this scenario as compared to the program? Like,
what I'm trying to say here is that person is only doing the role of removing the emotional blockages,
right,
and emotional empowerment. But for any other problem, you have to go to someone else.
Okay, makes sense.
Yes. So it is only that one aspect, which is like maybe if it's like in 100%, in that 100%, maybe it would be 10% emotional.
Like you have a car, so you come to me for your puncture, and then you go to for petrol, you have to go to another one, and for your mirror, you have to go to the third one. But with me on my station, I can completely transform your car, and you will get a brand new car, like it was not damaged before.
Yes.
Here is before your condition, and now see, here you are after working with me.
Yes. So pay
one complete amount and take your full transformation.
Yes.
Without going anywhere.
Actually, why I'm telling this thing is because I want to make people aware that, you know, they're getting so much. So they have
so much
to
value.
Understand the
Obviously,
value.
They have to understand the value you are going to them, giving them.
Yes, because removing emotional blockage in itself is not a simple thing. You have to. There is a lot of effort and a lot of hard work that goes into that. So that is why people charge that much only for that.
It means that the people who might be interested in your program are not like a common people. They would be professional business service providers. Like they are already in business. They are already earning in their businesses like a lot of money, but they are suffering due to whatever pain they have been gone through in their life already because of traumas and emotional childhood trauma, blocks and fears and insecurities. And this is what happens with the experienced service providers because they went through a lot of things in their life. And that's when they feel blocked and stuck, like where to go and who to ask for help. So that's where Dr. Sheetel is here with her very powerful emotional transformational healing program.
And I want more and more people to take advantage of this program. Because even if you go to a normal service provider, and my programs are not like they are not so costly as it's not like it's 10 times costly as compared to going to a normal person who's offering one of these modalities. Even though I am having 20 modalities, 20 things that I'm offering, but still it is a very affordable. It will be a very, very affordable package, because I know I'm over delivering over here, but still, because I want to help people, that is my mission. So I'm not looking at this as a marketing strategy or any kind of a commercial kind of a venture. I want to keep it as low as possible so that everyone can afford it.
But even if we say, if even in that scenario, what would be like a range for them, that if someone think, okay, no idea how much she might be charging, so what could be the range of like starting from this point to and onward? Like you might not be giving it $200, like this is not some kind of program for the $100. So in that scenario, what should someone like in a lower bracket scale from starting in approximately, this is what it could be the minimum, but its final price and service will be according to the situation of the person. Is there something that you have thought about, like?
I'm not actually, I have not yet come up with a proper figure.
Okay, so you are still working on it in a planning phase, finalization
Yes.
phase. Okay, no problem. Okay, and how someone should contact you, and how people can contact you who are looking to seek your help? How can they connect with you?
I can hand over my Facebook page,
Okay.
and they can connect with me through Facebook.
So they can message
That
you.
is the best
right?
that I can think of.
Okay.
And of course, because since it's online, they have to connect to me in some online way, online.
Like your social media, they can connect with you through your social media accounts.
Yeah, I'm planning. I'm actually going to open my page on Instagram as well.
Okay.
So these social sites will be there. They can connect to me over there.
Yeah, so they can send you a DM, right? They can send you a message.
Yeah,
for
they can send
if they are
me just a
interested.
DM. Yes, because I cannot really entertain, in all the queries, because I cannot entertain random queries. I have to know. I have to know what is the problem and which people are really serious about taking the treatment. So
right.
Based upon the messages, and after arranging a call, there itself, we can come to some kind of a conclusion about how it is supposed to go, and then probably we can share more details and go about it.
Like, so you want people, you want someone who is interested in your service to be very aware regarding what you are providing and what you are doing before approaching you and waste your time, like through the random inquiries, if interested in your high level program.
Yes.
And obviously then you are not available like to take all the random inquiries from everywhere, because that is not like working with everyone. It's like working with a specific group of people.
Yes. Right.
Okay, so it's very interesting, because I also learned a lot of things. I consume a lot of knowledge from you as well, by the mercy of Allah. So, and it is interesting to see that you are very keen to help the people to solve their problem, actually, not just to make money, but you are like a service provider who is very interested in to come up with a solution that can actually help people solve their problem with your help, as well as utilize your given knowledge and tool and resources to reutilize that by themselves again, without coming back to you unless it is necessary.
Yeah, right. Exactly. Yeah, you have summarized everything into short,
Alhamdulillah.
sweet one sentence. Yes.
Okay. is there anything else that you want to convey or tell to the people who might be watching? If someone is watching till this end, this video, it will be on the YouTube channel by the mercy of Allah, inshallah, on Legendary Freelancer. So, any message, anything that you want to say?
Yes. The one thing what I want to say is the first and foremost thing is whoever is watching this, whatever it is that you are facing right now or suffering from right now, remember one thing, that you are powerful and you can tap into your own power and you can activate your healing power if you get the right kind of a help. You can do it. So I want everyone to remember that whatever it is that you're suffering from, it doesn't matter what name of the disease or whatever name of the symptom, it doesn't matter. But there is only one thing that happens when you don't feel all right, and that is dissociation. Okay, you get out of your energy. Your energy actually, instead of being in a harmony, your energy goes in scattered directions and it gets blocked, and this whole thing is called as dissociation. So from dissociation, we have to go to centering. Centering means coming inside, coming within. So what I want to tell whoever is watching this, that look within yourself. That's one thing. Just 3 words. Look within yourself. And when you look within yourself, you will find all the answers. You would know where to go. You would know what kind of a help to seek. So that's what I want to tell.
So when you will, okay, that's enough. I think that's enough. A very interesting and good information. Anyone who is suffering in the life can understand the value that you have provided through this video as well. So the knowledge that you have given, that is also very beneficial for someone who does not know. At least he or she can understand the importance, like what are the things that are essential, not just the medicines, not just the medicine and treatment through the normal ways. By the way, are you also dealing in curing the incurable diseases, or it's like only like normal diseases, or what kind of diseases criteria is there? That I think would be very beneficial if you also include it. Like, is there any specific kind of diseases or not? What is that? What it is that?
Yes. Okay. Now,
because there are many diseases where even medicines don't work. There are many diseases where even the healings don't work, and the people, even after using all kind of healers and experts and doctors, they even suffer in the diseases which are like incurable, cannot be cured.
Okay.
Then what is that?
Yes. Actually, most of the diseases that we put into the incurable bracket are actually not incurable. It's just that it's the mindset of the patient, towards his problem. Because, when he has that limiting belief that this is incurable, so it actually starts becoming incurable. Because what he thinks gets manifested as his reality. I hope you get it, what I'm trying to say. Because this does not happen overnight, but it happens in due period of time. So now, for example, psoriasis, okay, example. Many doctors and the medical science says that it's an incurable disease. There is no cure for psoriasis. You must have read, you can Google it and check. I have cured cases of psoriasis, and I'll give you a very good example. There is this person, I don't call them as patients. So when he had come to me with just psoriasis on the leg. That was his only complaint, and he just wanted treatment only for that because it was bothering him so much. So with the same techniques, I started treating him, and his psoriasis started recovering. But as a side effect, what started happening? He was also a heart patient.
Okay.
He used to get heart attack once a year. He was having high cholesterol, like all unhealthy in the lab test. All the values are like haywire, and he was so much fear inside, so much panic that he had a limiting belief that now, and he was even like he had that superstition, you can say, kind of a thing which he had made into his own head, that from the months from June to September I get a heart attack. So every year between the months of June and September I get a heart attack. This has been happening for the last 4 years, whatever, 4-5 years, something was happening. That same thing was going on happening. And then he's labeling it, like he's putting it into that box, that the moment June month will come, and in the month of July I will get a heart attack. So what he'll do is he'll do all the tests in the month of June. He will go to the cardiologist and he will get everything done.
Well prepared,
and then,
for the destruction.
Yes,
well prepared,
like he's like actually preparing. And he's so much sure that he's going to get that heart attack. Now,
what a belief, what a faith.
Happened gradually. Yes. So this is what we get in the history of the person when you talk to them. So now, what happened was this also happened gradually. Initially, it was just a psoriasis, but then when that year passed by and he got all the tests done and everything was fine in the test, and even the year before that everything was fine in the test, and still he got the heart attack. But this time everything was fine in the test, and I told him everything is fine. So he said no, but I can still, even if everything is fine, I will still get the heart attack. So I said, how is that possible? How can you? He said, no, every year this happens to me. So I kept quiet. I did not tell him anything because I knew inside that the treatment is working. And then that year he did not get anything. He did not. So he was kind of like so skeptical. Even after that September, the month of September went by and he did not get a heart attack. Still, he was skeptical. He said, now, how can that be possible? I might still again get it any time. I said, okay, no problem. Even if you would get it any time, this treatment is going on. This will help you. So the moment you have any discomfort about any symptom in your body, just let me know. So he said, he was like kind of skeptical. Like he said, okay. And then, then after so many months, like he gave me that information that he gets these kind of headaches, sitting in his office. Whenever he feels the workload gets too much, suddenly he gets this headache. And then he gets that clenched feeling like in the throat and all that. And he does not leave his work. He still continues working. And these things were like happening to him again and again. And he told me this thing. And then immediately I understood what's happening. I could link that psoriasis, with this mindset, with all the things. And then I counseled him also a bit, and then I gave him a medication also connecting all those things. And then his headaches disappeared. And so you can see how it went. He came to me only for psoriasis. Not only did his psoriasis completely go away, but his headaches disappeared, his heart attack stopped. And now his limiting beliefs are also gone, because now he got that confidence in, because I did the counseling with him, he understood that what was giving that problem, because it was all these things put together. It was actually his mind that was creating that reality. So I made him aware. So now he's an absolutely healthy person, and his age is growing day by day, and he has like 3 times, thrice heart attack, thrice, no, not 4 times. He has suffered from this heart attack, and now he goes around like telling everyone that I'm absolutely fine. So this is like a reversal that is so amazingly, like, such an amazing result. So he had not come to me for all these problems. He never wanted treatment for all these things. But what happened in the course of treatment was automatic. So these things. So actually, what was the question that you had asked me initially for this example?
I could not remember the exact question. The question was regarding incurable disease, right? It was related to incurable diseases and treatment. We were talking about incurable diseases and treatment.
Yeah, incurable diseases. Yes. So there are these kind of things, like psoriasis. I give the example of psoriasis for that because it's considered as an incurable disease. But it's not that it cannot be cured. If you know what's happening to the person, you can cure anything. You have to just understand the person. Now, I will give you another example where, see, now, sometimes what happens is there are incurable diseases where medicines cannot reach, and even the healers cannot cure, and all these kind of things, as you mentioned. But over there, what happens is you have to go into the karma of that person, the actions and the consequences. So you have to get the spiritual perspective in those cases. And many of these incurable diseases, I've seen that it is directly linked to that person's lifestyle and the thoughts at the level of consciousness. How much that person understands his own karma and understands the principles of the morals and the principles of righteous living. So you have to sometimes offer them healing in that aspect. You can try to make that person understand, make them aware of working on a more spiritual, adopting a spiritual lifestyle, and taking care of their karma. So these things also matter. Sometimes it could be just that the person is just doing some things that in their lifestyle that's completely something wrong, like which is not good, beneficial for them. So even those could be the reasons. Sometimes the reasons could be very minor also, and then we just label them as incurable disease just because it gets into that box or that label. But sometimes it may be, the cure could be very simple as well. So see, as doctors, we can just try our best to heal and bring them to that state, but we are not gods. Ultimately the end is the highest person, the highest power. That's
obviously we are human. We can try. Power. We can try our efforts.
We can try our best. So even if it's an incurable disease, I would not like to put it in a box, and I would like to give my whole effort to that, in order to give relief to that person. But of course, like, there are things which are linked to your the soul journey and the spirituality aspects, and that is something which God decides. So in those cases, we can do our best, and that's it. The ultimate outcome will be decided by
the way,
divine.
Okay, I have a question. By the way, did you ever deal like a case of like incurable ventilator cases, like incurable ventilator cases, ventilator patients, ICU, CCU?
Now, yes, that's the I had one patient. She was kidney. She was having kidney failure, and
in ICU room.
Yeah, she was in the ICCU.
Okay.
And Actually, I've not been able to completely do my best for that patient, but yes, I did try I tried to give relief to that person, and it was working. But what happens is because people have their own mindset, in such cases, that if the person is admitted in the hospital, then they only want to listen to the allopathic doctors, and the allopathic doctors also make sure that no other person can interfere in between, no other healer.
Exactly.
So even if you do these things, then they have to be done with the permission of the relatives and the entire family. So there's a clash between people out there. So there are so many factors. So I hope that I would be able to help those kind of people also in the future.
Right. I was just asking regarding the experience, if you had any experience. That's it. Not about the future, obviously. That's a different thing.
Yes. The experiences, experiences as doctors. As a doctor, I have a lot of experiences. But now
you are not like coming up as a that kind of doctor, but a different kind of person.
And I'm sure this method, this CMHP method.
It's a C for C. It's C for CEO of your business.
Yes, C for okay. CMHP method, So I'm sure this will also help people in those kinds of distressing situations also. That maybe I have actually seen people coming out of these situations where where the people have just given up, and they have just the doctors have also given up, and they have said that nothing can happen for this person at all. This person is just going to die, something like that. And then the person has stood up. That has happened. There have been those kind of cases. So it's just a matter of your energy coming into harmony or balance. And if that happens, anything in the world can actually get cured, Even if you go to the last stage, but still it can happen.
Right, the healing, right. It can be, we can say that the healing from the God arrived, and the person is again healed from the disease.
Even in our textbooks, the ancient cures which have been mentioned, those times people did not have also so much of knowledge, but during those times the people have just there are these people, there is this lady in coma, and the doctor just understands, just by the sheer sense of understanding, he brings that lady out of coma. Now during those days, 100 years back, the knowledge was hardly. Today we have so much, we have so many things to help us. At that point of time, we did not have the internet, and we did not have those. We just had a telegram, and even the phone was not there. And so even in that technological, that kind of an age, people have given those kind of results.
Right.
So the doctors have been so one should not lose hope.
Okay, you have to be seen you have very well knowledge about spirituality, spiritual healings, and you are also a believer in that, in this kind of wisdom. Do you believe that the incurable patients, wherever they are in the world, let's suppose even if they are in ICU rooms of the hospitals, in many hospitals, they can be cured remotely and spiritually and wirelessly without even touching them, without even going and meet them? Do you believe that it is possible?
It's definitely possible. It is surely possible.
That the doctor is not going to meet them, and no matter where the patient is in the world, The doctor is curing and healing them from his own home without ever going and meeting them.
There are those kind of people who have recovered from such things as well. And you have a lot of modalities. Like actually, these are ancient. Nothing is new. These are all ancient modalities only. In fact, the ancient people knew a lot more than us. I should say that. So they knew so much about this energy. They knew everything, and these like hands-on healing and this quantum healing and this mesmerism and all these remote healing and all these things is not new actually, but it has started from lot of like ancient, lot of years, centuries back.
What about healing after death?
Healing after death?
After death. Like you have died, you have been over from this physical world. You are done. You are out. And now it's a simple question. Can a dead person perform the medical surgeries and operation of the incurable patient who are alive? And the person is dead. Who is the doctor? Can a dead person do this? Just a question.
I'm not getting. I didn't get your question.
We know that you and I, we are not dead. We are alive. So we can do healing and this kind of stuff, right? And there are many doctors and surgeons, medical surgeons and experts. But can a dead person who has been dead completely over, no matter burned in the fire or buried in the ground, can a dead person perform the medical surgeries and operations of the incurable patients who are alive?
Actually, I can comment much about these things because this is not related to science and it's considered to be non-scientific.
Definitely, so it is not related to materialistic science, obviously.
Yes, it's related to this quantum physics and
I'm talking about the dead. I'm talking about dead person. He is out and dead, over. The life is done. Now, can a dead person start treatment and perform the medical surgeries and operations without using any scientific equipment, and the person is dead and the patients are alive?
Okay.
Do you know anyone? Do you know someone? Do you know anyone who is doing it after death? You
personally, I do not know anyone.
No.
So maybe you can shed some light on that.
This
is a very interesting topic, actually.
Yeah, there is someone who is doing it for the last 500 years. He is featured in Pakistan on the media channel.
Okay. Oh, I see. Okay.
Even in the BBC, even in the BBC Urdu news, he is a featured sound.
Okay. So, but how do they know that he's the one who is doing it?
How do they know? Because he is the one where the Muslims and non-Muslims go for their treatment when they are frustrated by the medical doctors and other healers. Then they go there, and then he heals and even perform their surgeries. But he does not.
This is actually just a few days back. I read about it or I heard. I have a faint recollection about this thing. I had read somewhere or heard from somewhere.
About
what? That I know the name of. I forgot the name.
That person name?
Somebody told me the name of this person as well.
Shayakik? Shayakik?
I forgot the name actually.
His name is Shayakik.
Maybe this person maybe someone else also.
His name is Shayakik.
I'm not sure if he was from Pakistan, maybe some other country also. But the same thing I had heard, that the people actually come up and they give the reviews, like they give their experience and they say that, we saw this man like in front of us, and then they describe the face and like the name of that man and everything, and then that matches with that same man, who is dead. So it's like, they know that it is the same man, but like for the purpose of proving it to others, that thing is there. Like they are being asked, okay, who is this man? How does he look like? And all these things. So the patients actually have like given their experiences, and they have said that this man has come and he has spoken with us, and he has done the surgery on us. Like the person who was being done on, that person knows who has done it. Something like that I've heard like some days back.
Okay, so you don't remember the name that was told to you, right?
No, because I don't know, somehow I did not take, maybe I just thought it's just
might be
superstition.
joke or something like a rumor, myth and rumor that is very common on the internet.
Right, because sometimes there are all these false stories also. Rumors and all.
Definitely. And why?
Somebody told me also that it's a rumor. Somebody told me that also.
No. I asked this question because there is a very major difference between two things. One thing is that for thousands of years, people used to tell stories, and other people used to believe on those stories without even asking the proof. Without even doing their own research and verify whether this news is true or false.
Right.
And it continues from centuries to centuries to centuries. Yes. And people believe it. But there is a very big difference between like when random strangers are telling you versus the official TV channels of your country are featuring someone on various TV channels. Like there is a very big difference between a random guy on the street versus your official country public media channels and the newspapers are reporting about someone. Like this is what he's doing, and BBC is reporting, and the other media is reporting, and people are reporting. That's very different. Like it's not like a random person on the internet is come up with so many random claims. So this is why I ask if that like I can tell you.
That is
12 years ago, 10 years ago, I heard about a news like someone told when I started the research with my spiritual mentor, when we started the research on the fresh dead bodies, and then we went to the soul, and then we went to the creatures of nature. Like that is my very, very different area. Then it was like a humor. It was like a fake news that someone told that someone used to burn a Hindu in fire and he was not burned. He was immune to fire. So it was it was a news like I was very skeptical and I knew it is not possible. But the problem was that it has to be researched before believing. But when we researched, then it was figured out like it was a completely total fake news. It was a rumor and it was not true. But that was the turning point that transformed from the research of the soul to the fresh dead bodies. And our research went to the dead bodies, and from dead bodies to soul, and then it was a very different point and turning point of the life. And then I also came to know about that soul during my research after dead bodies, because it was the research after death, afterlife research. So then I discovered that there is very different thing happening, that the Muslim martyrs who are in the way of Allah, their physical bodies do not decompose without any chemical usage. As compared to in Buddhism and Catholic, like they use chemicals, and as reported on the National Geographic. But the physical bodies of Muslims martyrs are not decomposed. Even their blood is fresh in their bodies for centuries. It's very like
just preserved. Like
if you cut, the blood is starting like a fresh blood is dripping out.
Okay.
And we know as a doctor, if a person has been dead, the blood cannot remain fresh in his body even after a few hours. Is it right? So this is what's happening. But then another thing happened, like if not even their physical bodies have the powers, but even their spiritual powers increases, and they remain, they increases more. But for that kind of purpose, I came to know about the Shah Yaqub Bukhari, that his soul is doing the medical operation and surgeries, and many medical doctors like, no, it's not possible. So because the way I saw the reports on the media channel, they interviewed so many doctors about it is as well. What's your feedback? What do you say? But the patients, like I physically went there as well during the time of research. So it was like I wanted to know why it's happening. If it is happening, why? Then I came to know that it's a bit like going to religion, but I just want to convey you on the basis of knowledge, like you have an interest in this. So then I came to know that in the Quran, Allah has claimed that do not say those who are slain in the way of Allah that they are dead. They are alive. You don't perceive.
Okay. Yes.
Then I came to know, okay, this is the verse that is being connected to there. There is a claim of Allah in the Quran, and Allah is practically doing a demonstration in the real world to let the people think about it, that who is doing it all. So he is doing it all on the basis of showing that he is creator and controller of nature, and this is the point. So anyway, so the question, like, is it possible, like, so this is something might be new to you, but as a knowledge point of view, something like it's happening. I think that anything else?
Thank you so much for giving this kind of a time.
No problem. Thank you so much for the conversation, and I hope that
conversation, but it was very nice.
People will learn.
I should really thank you for that. You gave your precious time to listen to all this, and I really thank you for the whole thing.
All right. Thank you so much for coming, and have a nice day. Hope you will change so many lives, and hope you will help a lot of people.
Yes.
And wish you all the best in your business, online business, right? Online service.
Yes.